Okay, good day and welcome to today's section. So please, if you have any comments, you could drop on the comment section there. So good evening or good day. My name is Dr. Aliu. So we're going to be looking at conducting audit. This is a continuation of our series of laboratory audit programs. So today, the aspect we are looking at, which is module 3, is conducting audit. Although during the introduction, I did some overview on this. So we're going to be looking at terminologies, audit strategies, opening meeting, audit meeting, technique, recordings, gathering evidences, uh, closing meetings, record findings, and etc. So these are the things we're going to be looking out for this session. So let's look at some of the terminologies. We have audit criteria. So audit criteria are a set of policies, procedures, or requirements used as a reference against which the audit evidence is compared. So audit criteria. So every audit must have a criteria. Then there's what we call observations. Observation is a statement of fact made during an audit and is sustained by objective evidence. Now, objective evidence is that qualitative or quantitative information, that record or statement of fact pertaining to the quality of an item or services to the existence and implementing of a quality system element, which is based on observation, measurement, test, and which can be verified. So that evidence, that objective evidence, that information, that statement pertaining that what is being observed, what is being measured, which can be verifiable, is known as what objective evidence. We have what we call audit findings. So audit findings is the result of the evaluation, the result of audit of the collected audit evidence against what the criteria, which is like the requirement or the checklist. The conformity is the fulfillment to a particular requirement. The non-conformity is the opposite of conformity. A non-fulfillment of a specific what requirement is known as what non-conformity or non-conformance. So let's look at this aspect. So what are the benefits of quality audit? Now, these quality audit, that's what I would say, is a systematic evaluation, confirm and verify the activities as related to quality. Now, so for this to be done, it helps in achievement of the quality management system. One of the benefits of audit is to help in achieving what the QMS objective. If you do basic quality management system or ISO 1519 training, you should be able to have an understanding of quality policy, quality objectives, and quality indicators, how they tied up. The quality policy tells you what to do. The objective can be a defined goal, and the indicators are things you use in tracking or the objective, also to be in line with what the policy. So conformance with your requirements. So one of the benefits of quality audit is to check the conformance to what the requirement, a particular requirement. It helps in compliance with regulatory requirements, conformance to the recognized quality standard. It helps in meeting customers' contractual requirements. Serve as tools to improve the efficiency and the effectiveness of the quality management system over the long period of time. The internal audit can form as basis for organization self-declaration or conformity. It's also very important in component of the quality management system. So these are benefits of what quality audit. Now, what's the purpose of quality audit? Why do we do audit? So as an auditor or as someone who is going to do audit, the focus of any management system audit is to determine the management system has been developed, one, if it has been effectively implemented, and if it has been maintained. Please underline those three words. Developed, one, that means having those systems in place. The process, the procedures developed is one thing. It's possible it is developed, and it's possible that it's not being implemented. And it's possible that it is implemented, but it's not effectively implemented. So something can be implemented, and yet it's not effectively implemented. If it's not effectively implemented, then you cannot get the full benefit. One of the purpose of doing all this, we want to see does that process exist, that's developed implement? Is it developed? That system, that management system, is it developed? If it is, now we want to go further to check if it was implemented, if it is effective, if the implementation is effective. Next, we want to see if it is being maintained, that quality is being maintained. Because sometimes people can develop a system and they implement it, and over a period of time, it's not being maintained. So, for one of the key purposes of the quality audit is to check if the quality system audit to determine that management system has been developed, if it's been effectively implemented, and if it is being maintained. Now, internal audit must be planned to establish that the management objective as defined in the quality system are met in all aspects, including the personnel at all levels satisfactory, carrying out their assigned duty and responsibility. So the procedure is detailed in quality system as follows. So audit should be designed in such a way that it reveals the extent of compliance with the requirements of all the elements that is examined. So let's say, for example, you're auditing a particular section or you're auditing the whole phone. Every aspect that is being audited, there must be a compliance to what the requirement. Now we have talked about this type of audit. We said it: external audit, internal audit, focus audit, scheduled audit, and unscheduled audit. All these are different forms of audit. We explained this in our module 1. So external audit is conducted by someone outside the organization. Second, the third party audit. Internal audit is someone within the organization. Then focus audit has to do with when you are auditing a particular aspect. Audit can also be carried out if the particular problem is occurring. So let's say, for example, you're having issues in your analytical aspect, or let's say your additional services, value added services you are doing, your operations and all this, you can carry out a focus audit on that aspect. Now, schedule audit, we have unscheduled audit, unannounced. Schedule audit, examine you document, resolve the process, identify it, and help to improve them. They want to talk about audit strategies. We have 3 major audit strategies: 1 horizontal, 2 vertical, 3 witnessing. These are the 3 audit strategies: horizontal audit, vertical audit, and witnessing. Now, in the simplest term, when we talk about horizontal audit, this examine one element in the process or more than one item. You check specifically. Let's say, for example, now we verify that each element of the quality management system is being implemented and effective. Let's say, for example, now I'm auditing equipment management. So everything about equipment. So that is an horizontal. Now, vertical audit is you pick a sample of report randomly, then you will check all the elements of it. So I can decide to pick 2 samples, 3 samples number, and I will check which personnel did the test or collected the sample. Now, is there SOP for sample collection? I can even check the personnel file on that. The person had the qualification to collect sample. Then I can also move to sample processing. Who processed the sample? Okay, when the sample was spun, what is the centrifuge, like what is the RPM that it was used to spin the sample. I can also go further to say, okay, now for the centrifuge that was used, I think they calibrated. So now I can still go further to say, okay, even the sample bottles that were used, has it been validated? So every element of the quality management system can be tested through there. You can even I can even go further to check, does the personnel has vaccination record? Then I can go ahead and check who analyzed it, the QC that was done that day, the EQ that was done. So we call it what? Vertical audit. Such a way that you pick a particular samples randomly, you check all the quality system essentials, you check all the requirements, and that's what we call vertical audit. Which next thing is employee competence. So you ask an employee to carry a particular task or a process in line with the standard operating procedure and see for compliance or not. That is known as witness. If I can decide to say, okay, do a WIDA test, do an HIV serology test, do this, okay, collect a sample using venipuncture technique. So I will stand there as an auditor and watch the person do it, then assess the person based on it. That is what witness. So we have horizontal audit, we have vertical audit, and we have work weakness. These are three key audit strategy. Is that well understood? Please, is that well understood? Please type on the comment section that you understand what I'm saying. Please, if you understand what we are saying, please type on the comment section if you have any question. Okay. Thank you. I understand. Yes. Okay. So let's continue. Let's continue. Okay. So guidance for conducting audits. Uh, Audit shall be carried out according to documented guidelines and procedures. The conducting an audit, you have to have a defined interval, conducted at defined intervals. So what time, what duration. Program such that each element of the quality system is checked at least once a year. Then formally plan and execute by trained personnel. So audits are not conducted by untrained personnel. So you have to be trained and certified before you conduct audit. Conducted in an objective manner. So in conducting audit, it shouldn't be based on subjective. It should be based on objectivity. Conducted by qualified personnel, independent of the activity of the to be audited. So even though it's an internal audit, you can't audit yourself. So let's say, for example, you're working in a hematology lab, you can't audit that lab. So you can't audit yourself, independent of the activity to be audited. So designed to identify the extent of compliance with the requirements of the competency of personnel. That's why internal audit, you shouldn't have only one person in the facility or the organization who have an understanding of audit. Are we communicating? So the audit needs to be reviewed by the what? The management. Now, when we talk about audit process, this is very important. Please look at this. So first, it starts with a plan. So as a quality assurance personnel, as an auditor, you have to have a plan, audit plan. Normally, in every organization, you should have what we call the audit assessment policy, the audit policy, the SOPs, the plan, and etc. So first, you have the audit plan. You develop checklists. If you don't have a checklist, you can develop a checklist. Take an opening meeting, gather the evidence, record your results, closing meeting, then we have the audit report and what a follow-up of the audit. This is what is known as the audit process. One, you should have an audit plan. Two, develop a checklist. Three, do opening meeting when you get there, gather the evidences, record the result, and you do closing meeting, do audit report, and what follow-up. Every aspect of this must be put in place. From the audit plan to the follow-up has to be well understood by you and also be done. So, we want to talk about audit preparation and planning. What are we looking at? Ensure that auditors are trained and skilled. Develop terms of reference for auditors. What is the term of reference? Agree on the audit checklist and the tools and the form that you should be used. That has to be. Ensure the laboratories are giving adequate notice. Develop schedule in collaboration with the laboratory. Collect any documentation needed beforehand. Let's say, for example, some manuals, some things that because you may not have all the time to access them when you are there. So you need to collect all this information beforehand. Agrees on the rules and responsibility of each project team head. Let's say you are maybe two or three. So you need to agree and okay, me, I'm the lead auditor, I'm auditing management, me, I'm auditing chemistry lab, I'm auditing hematology. All these things have to be what agreed within there. So that you don't go there and start having rancors. So this is what I'm to do, is not what I'm not going to do. Plan the travel if you need to travel, if it's tra city, logistic break, lunch, all these things you have to work. Uh, you have to plan it. If you don't plan it, you just keep auditing. At the end of the day, even the auditing may run and leave you. because so you have to plan even their breaks. There are some places you go to, let's say maybe in part of this continent, especially the northern aspect. Maybe if you're auditing on a Friday and they need to go and pray, you don't prayers break. You have to factor it into the, or else you won't see the auditing. Are we communicating? So then we have what we call the opening meeting. Opening meeting is the brief meeting in contact with the management just prior to the audit to confirm the arrangement should be undertaken before initiating the audit process. We will have that opening meeting. Opening meeting will focus on the following: one, introduction of the audit team. So this is the lead audit, this is lead auditor, this confirmation of the audit criteria. You review the audit scope and the objective to the auditee. Then your explanation of the audit process, clarification of any relevant details, confirmation of the timetable, including time, date, and closing meeting, and what will be done, how long the audit is going to take, all these things captured in the audit. Then you should have an attendance for the opening meeting. Are we communicating? Then collecting and verifying the information. Here you do the internal audit conducted by reviewing the document and the records, observing activity, asking questions, evaluating response. These are key. So during the audit, you gather the information that is necessary. Only information that is verifiable should be accepted as evidence. So if that information is not verifiable, oh, we used to do it. Okay, where is it? We have it. Oh, it's not here. That is not a verifiable what? So there's what we normally say as auditor. We say in God we trust, in every other person we audit. So you can't just take a mere information. Oh, we normally do it. Where is the evidence? Where is the proof? And audit evidence leading to audit finding should be what? Recorded. Conducting document review. The auditor will verify the following: the information in the document is provided, whether it's completed, because there are some information in the document that may not be completed. The consistency of the document, the currency of the document. Is it current? Is it up to date? Is it outdated? Should it have been reviewed? All these things are things we check. So you check the completeness of that point. Let's say, for example, now, there are some things that must be in a safety manual. If you can't find it there, that means that document is there, but it's not complete. I will communicating. So you check for complete, all expected information to be contained there. Then if that information is correct, if the information is consistent, and if the information is current. So we'll call it the first C in conducting document review. Check for completeness, check if the information is correct, check if it's consistent, check if it is what? Current. Complete, correct, consistent, current. Now, conducting document review, the auditor will verify the following: the document is provided, is approved prior to use. So the document will be approved, reviewed by as required. The document being reviewed cover the audit scope and etc. Then sufficient having sufficient information to support the audit what objectives. So those are the ways we conduct what document review. Then we want to talk about lab records. How to review lab records. Talk about 4 C's for what? Document. Now we're talking about the review of lab record. You check for correctness. You check whether it is complete. Let's say, for example, now you are picking a record. Let's say, for example, a patient requisition form. You check if it's correct, check for completeness, check if there's amendment or correction, the identities, supervisor review, if possible, storage, maintenance, indexing, retention, archiving, all those things are things you are going to check when it comes to record. I hope we know the difference between document and record. If we don't know that, please go back to your basic quality management system. The difference between document and record. I won't be explaining that in this program. Now, records can be captured and maintained electronically or paper-based. Could be in logs, could be in worksheets, could be in forms, could be in checklist. Whatever it is, ensure that these things are checked. Audit interview. So at this point in time, you are asking questions, you're evaluating response, you are confirming all information. So that's what it is like. Do you have so and so this? Say yes. Okay, show me proof. So interviews are held with persons from appropriate levels functioning and performing activities or performing a task. Oh, do you do quality control here? Yes. Oh, How many levels of quality control you do? 2 levels, 3 levels. Can I see your quality control SOP? What quality control material? What's your protocol? What's your policy on it? Reason for the interview and take any notes needed to be explained. That's the way you should. Reason for the interview and any note taking needs to what? Be explained. They will have what to call audit skills. So as an audit, in audit interview skills, what are the things you should have? In the interview may be initiated by asking the person to describe their work. What do you do? Or what do you do here? Ask open-ended and probing question. How, what, why, where, who, rather than closed one that can say yes or a no. No. The type of question that are carefully selected should do an open question, closed question, leading question. How, where, why. Not do you do this, yes or no. Those are closed-end questions. So you have to be encouraging. You have to avoid challenging and intimidating staff. Listen carefully to respond and ask for clarification or further information. If you have any clarification on it, you can ask. Don't not prompt answer or make assumption for them. Record the detail immediately so that you not forget it. Then all these interviews for the people, thank staff at the end of the day. Say somebody actually bring a document and say, okay, actually, oh, thank you. Hmm? At the end of each of the interview you are having with the person, you thank. Auditors should not be subjected to interrogation. So they are not in police custody. Are we communicating? Yes. So when we talk about these interviews, talk about questioning style. We have close questions. Now, questioning style, this is the type of question you asked, and the way in which questions are asked are critical in response. The way you ask the question determines the kind of answer you get. Different type of questioning style exists, and each can prove to be what effective in specific circumstances. So let's do some of the questioning style include closed questions. Closed question invite yes or no response, but may miss significant piece of information. Like, do you do quality control? Yes. Are you getting? So that's a closed question. Open question. Open-ended question clarifies documents seen, observation made, and confirm point. Ask your question like show me how or tell me about. Tell me why, where, and who and what are likely to obtain a richer body of information than a closed question. Tell me how you do your quality control. Is an open-ended question. Or like, do you do quality control? Yes or no. So, do you do quality control? Yes or no. That is an closed-end question. Open-end question is how do you do your quality control? Young lady, scientist, how do you do your quality control? That is what an open-ended question. It is often unnecessary to ask all the checklist questions verbatim. An experienced auditor can often learn to answer multiple check questions through an open-ended question. Let's say, for example, I've asked an open-ended question. By the person answering that open-ended question, there are some of the things he would have answered in my checklist. So I don't need to ask him again. Why? Because he has already answered in doing the word interview and the open-ended question that I gave to the person. Is that well understood? Please, if you understand what we are doing here, please type on the comment section. I understand. Just type I understand. Okay, what did you just know? Okay, thank you. Thank you for the response. So, audit questions, we have what for hypothetical questions. We have open-ended, I've talked about closed-ended, We're talking about now hypothetical question. Hypothetical or what if question can be helpful but must be used with caution. If the auditors consider a particular circumstance to have a potential to lead to quality problem, but can find no evidence to show that this has yet happened, and are unable to persuade the auditing of the potential for problem, they can hypothesize the circumstances under which they think the problem will arise by asking what if. Now, example, no hypothetical question, are discordant result tracked and appropriately correctly action taken? Yes, partial, no. Like so it's a way of asking a question hypothetically. What if this happen? There's no thing retrospective and hypothetical. So, like, what if this happen? So, like, you are trying to just give a scene at discarded results taking track and appropriate corrective actions taken. Normally, that is not a normal process. That's not a frequent thing. A discordant result. So when you have a discordant result, are they tracked and appropriately are there corrective actions taken? Because this is like what if. Let's say for example now you give a wrong result. What if you give a wrong result? Normally you're not expected to give a wrong result. What if? That is what hypothetical word question. Then we have what we call observing lab operations and practice. Observing lab operations to ensure that laboratory testing follow the written policies and the procedure. Written policies and the procedure. Let's say, for example, if the policy of the lab said they do QC every day, and at the end of the day, you are seeing 1 in 3 days, you need to ask. That means they're not following the policy, the written policies and procedures. About the procedure that are appropriate for the testing that is performed. If the deficiency and non-conformity identified are adequate, are they adequately investigated and resolved within the established time frame? When there's a non-conformities, are they identified? Are they being resolved within the time frame? These are the things what you ask. We have auditing samples, generating auditing reports, and etc. We want to talk about generating auditing report. Now, all the evidences that you have gathered against the audit criteria and the audit scope. Now, you need to indicate the conformity and non-conformity, whether it's partial. It all depends on the checklist you are using. They should be reviewed with the auditee in order to obtain acknowledgement. So let's say, for example, now you have gotten a finding. Now you need to relate that finding with the auditee, and the auditee needs to have an agreement with you that, oh, this is a non-conformance. You need to explain to him or her this is non-conformance. Every attempt should be made to resolve any diverging opinion concerning auditee evidence or finding. Oh, there was a findings, audit finding. Maybe the team saying no, no, no. So you need to explain, resolve the point, and both of you need to agree that this is a non-conformance. You can read the clause or read the standard and explain to the person and what it is. Audit report will capture individual audit findings. Should include what? Conformity and good practices along with the supporting evidence. Opportunities for improvement. So you can have things like core observation, conformity, non-conformities, and what observation. So you have to record what? Your audit what findings. So the non-conformance or the deficiencies happen within the lab. These are your non-conformances. We have two type of NCs, major NCs and minor what NCs. So major NCs are those things that can significantly impact on the outcome of a patient's result or patient satisfaction. That is what a major non-conformance. Minor non-conformance are trivial, maybe due to isolated mistake rather than issues. Those are what minor non-conformance. Now, a minor non-conformance can be a major non-conformance if the non-conformance has been raised before and it's minor. If it's being picked up again, it's what a major non-conformance. Any non-conformance that can significantly affect the impact of the patient manual or the outcome It's a major non-conformance. Let's say, for example, if you don't run quality control, it can affect the outcome of a result. That is a major what? Non-conformance. If you don't put fixed mass or PPE, it may not actually affect the outcome of the result. That is what a minor non-conformance. But a lot of safety issues are also regarded as what major non-conformance. They discuss non-conformity with the staff involved and the problem. Be sure that they are given the opportunity to explain before you make your final decision. Ask questions that help staff to identify the cause of the problem. Encourage staff to make a proposal for what corrective action. So they are to propose like their corrective action. Then you look at it as an auditor and say this corrective action, oh, is able to meet up what this non-conformance, is able to clear this non-conformance, and the evidence of what clearance also has to what be there. Well, we talk about what typical audit findings. So now, documenting the non-conformance required item, you need to address those non-conformance. Let's say, for example, outdated copies of documents still in use, non-assigned responsibility or for auditing documents, non-maintenance record for equipment, required content in test report missing. All these things are types of audit findings you can also find. Audit team should meet privately after reviewing all aspects of the process to discuss what the situation. So sometimes we have what we call on-site, conference room, or off-site, depending on where you want to discuss that. Even one-on-one person audit requires some time for deliberation. So you have to deliberate on some all these findings and ensure that you do the right things. Are we communicating? Decide who on the audit team will lead the closing meeting and who will present any detailed finding, observation, and any what recommendation. This is very, very important. Then the closing meeting, yeah, these are the things you check out in the closing meeting, the auditing meeting, discuss the audit results, discuss the challenges, gather and collate all the results, appoint maybe someone who can speak in the closing meeting. We're talking about doing audit as a team. Discuss the summary of the audit findings, all the things you find in the audit. You need to also what put it. Discuss the corrective action, determine the resolution dates. Oh, 1 month, 2 months. All this should be captured in the policy, in the policies of they identify the corrective action if possible. Then this should form part of what the closing meeting. That is important for us to follow up on all the audits. The auditor is responsible to follow up to check up actions that have been taken to address what the non-conformance that was raised. The actions are structured in action plan. So they should get an action plan. So now this non-conformance has been raised. What is the action plan? If an auditee persistently fails to carry out the assigned follow-up action, the auditor must inform the managing director who will take steps to ensure that the follow-up actions take place. As the follow-up actions are completed, the auditor will record them by issuing an original audit report. Then that auditor should also sign off. Once the follow-up action has been completed, the auditor will sign off that audit report are completed. So when they are submitting the audit report at the auditee, they are expected to submit what the corrective action. Once we have accepted the corrective action, they clear it and show evidence of clearance. Let's say, for example, now you identify that a particular test does not have an external quality assessment program. So they put in that corrective action, and once they have the external quality assessment program being implemented, they should show an evidence. And evidence could be a report of the EQA. That could be an evidence. So every non-conformance raised, when they are clear, there should be an evidence before the auditor will what? Clear that as part of it. So this is some of the things we need to know when conducting